The components of the nursing meta-paradigm include 1. Person, health, environment, and theory. 2. Health theory, concepts, and environment. 3. Nurses, physicians, health, and patient needs. 4. Person, health, environment, and nursing. Answer 4. Person, health, environment, and nursing. Rationale. The nursing paradigm focuses on person, health, environment, situation, and nursing. All the elements interact with one another, with the patient being central. While working in a community health clinic, it is important to obtain nursing histories and get to know the patients. Part of history taking is to develop the nurse-patient relationship. Which of the following applied to Peplau's theory when establishing the nurse-patient relationship? Select all that apply. 1. An interaction between the nurse and patient must develop. 2. The patient's needs must be clarified and described. 3. The nurse-patient relationship is influenced by patient and nurse preconceptions. 4. The nurse-patient relationship is influenced only by the nurse's preconceptions. 5. Generates knowledge, patient care. Answer 1. An interaction between the nurse and patient must develop. 2. The patient's needs must be clarified and described. 3. The nurse-patient relationship is influenced by patient and nurse preconceptions. Rationale. There is continual interaction by both the patient and the nurse throughout all phases of the nurse-patient relationship. Focus on interpersonal relations between nurse-patient and patient's family phases. Pre-orientation, orientation, working, resolution. Middle range theory. Option 4 is incorrect because the focus is only on the nurse. Answer 4. Theories will be tested to describe or predict patient outcomes. Rationale. There are multiple theories for the practice of nursing. These theories are tested to develop the evidence to describe or predict patient outcomes. To practice in today's healthcare environment, nurses need a strong scientific knowledge base from nursing and other disciplines such as the physical, social, and behavioral sciences. This statement identifies the need for which of the following? 1. Systems theories. 2. Developmental theories. 3. Interdisciplinary theories. 4. Health and wellness models. Answer 3. Interdisciplinary theories. Rationale. As the health system evolves and the health care needs of the patient focus on health promotion, illness prevention, and treatment. More disciplines are involved in patient care. To be effective in practice, nurses need to be aware of theoretical approaches of care arising from other disciplines and from nursing. Which of the following theories describe the life processes of an older adult facing chronic illness? 1. Systems theories. 2. Developmental theories. 3. Interdisciplinary theories. 4. Health and wellness models. Answer 2. Developmental theories. Rationale. Developmental theories describe and predict behavior and development at various phases of the life continuum, as in the phase of older adulthood. A theory is a set of concepts, definitions, relationships, and assumptions that 1. Formulate legislation. 2. Explain a phenomenon. 3. Measure nursing functions. 4. Reflect the domain of nursing practice. Answer 2. Explain a phenomenon. Rationale. Theories are designed to explain a phenomenon such as self-care or caring. A theory is a way of seeing through its set of relatively concrete and specific concepts and the propositions that describe or link the concepts. Theory is essential to nursing practice because it select all that apply. 1. Contributes to nursing knowledge. 2. Predicts patient behaviors and situations. 3. Provides a means of assessing patient vital signs. 4. Guides nursing practice. 5. Formulates healthcare legislation. 6. Explains relationships between concepts. Answer 1. Contributes to nursing knowledge. 2. Predicts patient behaviors and situations. 4. Guides nursing practice. 6. Explains relationships between concepts. A nurse ensures that each patient's room is clean, well ventilated, and free from clutter, excessive noise, and extremes in temperature. Which theorist's work is the nurse practicing in this example? 1. Henderson. 2. Oram. 3. King. 4. Nightingale. Answer 4. Nightingale. Rational environment as the focus of nursing care and others. Everything about the environment. Public's grand theory. A patient with diabetes is controlling the disease with insulin and diet. The nursing health care provider is focusing efforts to teach the patient self-management. Which of the following nursing theories is useful in promoting self-management? 1. Newman. 2. Oram. 3. Roy. 4. Peplau. Answer 2. Oram. Rationale. Oram's theory of self-care provides a solid theoretical background for self-management for a variety of diseases. This theory shows the nurse how to direct the patient towards self-management to promote health and/or sustain wellness. Grand theory. Which of the following statements related to theory-based nursing practice are correct? Select all that apply. 1. Nursing theory differentiates nursing from other disciplines. 2. Nursing theories are standardized and do not change over time. 3. Integrating theory into practice promotes coordinated care delivery. 4. Nursing knowledge is generated by theory. 5. The theory of nursing process is used in planning patient care. 6. Evidence-based practice results from theory testing research. Answer 1. Nursing theory differentiates nursing from other disciplines. 3. Integrating theory into practice promotes coordinated care delivery. 4. Nursing knowledge is generated by theory. 6. Evidence-based practice results from theory testing research. A nurse is caring for a patient who recently lost a leg in a motor vehicle accident. The nurse assists the patient to cope with the situation by applying which of the following theories? 1. Roy. 2. Levine. 3. Watson. 4. Johnson. Answer 1. Roy. Rational. Roy focus on adaptation and helps patient cope with changes. Watson focus on caring, T. Transpersonal relationship. Which of the following is closely aligned with Leininger's theory? 1. Caring for patients from unique cultures. 2. Understanding the humanistic aspects of life. 3. Variables affecting a patient's response to a stressor. 4. Caring for patients who cannot adapt to internal and external environmental demands. Answer 1. Caring for patients from unique cultures. Rationale. Leininger's theory of transcultural nursing focuses on the patient's culture and the impact of culture heritage on healthcare needs and interventions. Middle range theory. A patient is admitted to an acute care area. The patient is an active businessman who is worried about getting back to work. He has had severe diarrhea and vomiting for the last week. He is weak, and his breathing is labored. Using Maslow's hierarchy of needs, identify this patient's immediate priority. 1. Self-actualization. 2. Air, water, and nutrition. 3. Safety. 4. Esteem and self-esteem needs. Answer 2. Air, water, and nutrition. Rationale. The immediate priority is air, water, and nutrition. The patient needs to have sufficient air exchange, which might require oxygen administration. In addition, the patient needs to have appropriate fluid balance and some nutritional supplement. A nurse is applying Henderson's theory as a basis for theory-based nursing practice. Which other elements are important for theory-based nursing practice? Select all that apply. 1. Knowledge of nursing science. 2. Knowledge of related sciences. 3. Knowledge about current health care issues. 4. Knowledge of standards of practice. 5. Knowledge of always adapted by patient. Answer. 1. Knowledge of nursing science. 2. Knowledge of related sciences. 4. Knowledge of standards of practice rationale, regardless of which particular nursing theory is selected. The nurse must use knowledge from nursing and related sciences, experience, and standards of practice when providing care. Henderson's theory focus on principles and practice of nursing. Assist patient with 14 basic activities. Which of the following statements apply to theory generation? Select all that apply. 1. Builds scientific knowledge base of nursing. 2. Discovers relationships of phenomena to practice. 3. Tests specific phenomena. 4. Identifies observations about a phenomenon. 5. It is solely based on nursing practice. Answer. 1. Builds scientific knowledge base of nursing. 2. Discovers relationships of phenomena to practice. 4. Identifies observations about a phenomenon rationale. Theory-generating research identifies observations or describes phenomena. It contributes to the scientific knowledge base of nursing. Relationships of the phenomena to practice and testing specific phenomena are part of the theory testing research activities. Which of the following statements about theory-based nursing practice is incorrect? 1. Contributes to evidence-based practice. 2. Provides a systematic process for designing nursing interventions. 3. Is not linked to nursing outcomes. 4. Guides the nurse's assessment. Answer. 3. Is not linked to nursing outcomes rationale. Theory-based nursing practice does reflect nursing outcomes. For example, prescriptive theories address specific nursing interventions and predict the patient response. Which of the following types of theory influence the evidence in current evidence-based practice EBP? 1. Grand theory. 2. Middle range theory. 3. Practice theory. 4. Shared theory. Answer. 2. Middle range theory. A nurse is preparing to begin intravenous fluid therapy for a patient. Which category of theory would be most helpful to the nurse at this time? 1. Grand theory. 2. Middle range theory. 3. Practice theory. 4. Shared theory. Answer. 3. Practice theory.